Hello guys, as you know today on Wednesday, as we have said last week, we have discussions on medical issues concerning our health. Today I have our guest also. Let him introduce himself for today's discussion and he will give us the topic which we are going to discuss. Welcome.
Thank you.
Yes, sir.
Thank you, Isaac.
Yes, welcome.
Yes, as Isaac has said, we agreed that on Wednesday we'll be tackling one condition that is also becoming a problem in the society. Today we are going to talk about tuberculosis, or the common known as TB. I'm Dr. Julius from Siloam Medical Center, Githurai, and we also have another facility in Kamakis. So those are two facilities that we normally operate. And all these things that we are going to talk today about TB, they are treated. You can access those services there in those two facilities. Thank you. Welcome.
Okay, welcome. Yes. As we have said today, we are going to discuss about tuberculosis. So, Dr. Julius,
Yes.
what is the meaning of the word TB? Tuberculosis. In short, what is tuberculosis and how does it affect our body?
Okay.
Yes.
Yes, tuberculosis, Isaac, is that TB is an acronym.
Yes.
Yes, for tuberculosis.
Yes.
And tuberculosis is an airborne disease.
Yes.
Caused by a bacteria called Mycobacterium tuberculosis.
Yes.
Yes, that is, and it is normally transmitted through the air droplet. Yes, when somebody cough, that's the time you pass that. Yes, through coughing. But it can also be passed through coughing. Can be passed through talking, the way we are talking. It can also be passed through sneezing. Yes, and all three areas. They have the one that is mainly the cause of tuberculosis is coughing. That is with the highest prevalence. Yes, but the one with the highest intensity of passing those bacilli is sneezing. When you sneeze, because you are using a lot of effort, even the muscles from the chest, that's the time you produce a lot of mycobacterium and you pass it to the surrounding. So that is the one that you see, the high intensity, but the one that is very common is the coughing. Okay. Then the last one is talking. The way we are talking, you can still pass those bacilli, but it is on the lower side.
So do we have some parts of the body which are more affected than others?
Yes, we normally say TB can affect any part of the body except two areas. Yes. Except the hair and except the teeth. Yes, so those are the only area. But you can get TB for any other part of the body. You can get TB of the eye, TB of the nose, TB of bones. Yes, it can affect any other part of the body except the hair and the teeth.
Okay. Yes. So we have some types of TB on some levels. Yes. So do you have even some one stage or another one? Or in short, what are some of the types of TB?
TB, we normally have at least, we can say there are two major TB types. Yes. The one that we call the active TB. Yes. The active TB is the one that is, which we normally call a disease. Yes. Which we call the tuberculosis disease or TB disease. Yes. TB disease is when you have an active bacilli in your body. Yes. That you can infect others. But there is another one that is called latent. Yes. Latent TB is that we believe that everybody who has been born will have that latent TB. Latent, as the name suggests, it means that it is not active. It is covered by the immunity of the body. So all of us have latent TB, but when you get now sick, is what we call the active TB disease now. Yes, but the other one is called latent infection. But for the other one that is active, is called active TB disease or TB disease now. Yes. So, but also the latent TB can also progress to become TB if the body immunity is compromised. So it can become now what we call the disease now. Yes. But everybody of us has a latent TB in your body, but there is still treatment. Probably when you come to the treatment, you'll be able to test to say what kind of treatment we give to latent, what kind of treatment we give to the other kind of the disease now. Okay. Yes.
So what are some of the signs and symptoms of TB?
Signs and symptoms, there are many, yes. But I can talk about the major that one we talk. Yes. Number one, the major cause of TB, signs of TB or symptom is what we call coughing. Yes, and coughing there before we used to say it's a coughing for more than 2 weeks. But nowadays we have ruled that one out. It is cough of any duration. Whether it is 1 day, 3 days, 4 days, it is you are a candidate of being checked for TB. The other one we call is what we call the fever. Fever is hotness of the body. A temperature that exceeds 37.5, that's another sign. The other one is what we call sweating. And not sweating, we normally call it night sweat because it's normally come at night. It's very hard for a TB person to have sweat during the day. That's why it's called night sweat. And when we talk about sweating, we call it drenching because it is that sweat that soak your body to an extent that you soak. The clothes are soaked. That's what we call the drenching. So the other one is also, and when we talk about coughing can be just normal coughing, but you can also experience what we call hemolysis. Hemolysis is when you cough sputum that has blood stained inside. So if you have that, the other one is loss of weight. And when we talk about loss of weight, we talk of unexplainable loss of weight. It is you are losing weight, but you cannot attribute it to anything. You are not dieting, you are not jogging, you are not slimming, but you are losing weight. So that weight need to be checked. So I think those might be the thing. There can also be loss of appetite, vomiting, but the one that I have mentioned there before, they are the major ones that we check. Yes. And it's also good to say that it is not a must that you have all of them. You have 1, 2, 3. Even if you have one, you need to be tested. So you don't wait for you to have all of them so that you come to the hospital.
Okay.
Yes.
So do we have some parts of our country whereby TB is common?
Yes, but mainly TB cut across every country, and not just not country or not part of the country, but it's countrywide, because TB growing well where the condition is inhabitable. There is no good condition, like in the slum place where there is a lot of congestion, like in school, in prison. So I might not be able to say that exactly it is found in Western or Eastern or Central, but any place, whether it's Central or Eastern, as long as the condition is conducive to grow those bacteria, like in prison, schools where there are a lot of congestion, there is those things that poor filtration, all those things, it is going to start growing those bacteria.
Okay.
Yes.
And why is TB is a global health issue?
Yes.
Affecting our community. Why is it that TB is a common
Yes.
disease cutting across, as you have said,
Yes.
it can cut across all parts of the country? Why is it so? Is a health issue cutting across?
I think one is, if I say Isaac, is that it's also a global catastrophe. It's a problem in the entire country. In fact, it is number 4, the condition that bring a lot of burden to the country, and not just Kenya but worldwide. It is number 4. When you count the things that burden the country, TB is number 4, and therefore it is of concern that is supposed to be addressed, because if you don't address it, it's going to affect the economy, it's going to affect people, and you see it is also you can also transfer it to other people. So meaning that it is also going to bring other conditions or other problem in the country. So it cut across the country, but it is a major issue in the country. In fact, the recent, I think, statistic that we have is for 2023, where we had allowed 169,000 people being got sick in that year, 2023, with 266 cases of patient daily that are treated daily or that are diagnosed daily. So you can see how great it is, how pandemic it can become. Because if you are getting allowed 266, almost 300 people are detected daily out of that they are suffering from TB, it means it's a national concern. And the issue that normally we are concerned about is not even the one that have been tested, the 266. The problem is what we call the missed cases. Missed cases means that there are patients who come to our facilities, even probably in our facility, but we miss detecting that they have TB. They came with the TB, we treat other conditions. We treat it as pneumonia, bronchitis, asthma, and we miss that it was TB. You can imagine that patient will then go back home and continue transmitting or infecting other people. So that is the problem. And we are told that in every 10 cases you find, 4 cases are missed cases. It is to mean that they were missed. So you can imagine how many cases we are missing. If you have allowed 20 people here, it is to mean allowed 5 or 10 people are missed cases. They went home back without having been treated or diagnosed for TB so that they can be put into treatment.
Okay, so how can someone diagnose TB and how can we treat it?
Okay, I think for the diagnosis there are many, but I can give the major. The major one that we normally do is what we call, because we have seen there are 2 kinds of TB. There is the latent TB, there is the active TB. For active TB, we normally use the sputum, which is very common. And sputum means that you give a container, he or she put some sputum there, you'll be able to detect whether they have TB. Sputum, and sputum can be done what we call the AFB. That is the normal test we normally do for TB. But that one will only tell you whether the person has TB, but will not tell you whether the person has resistance to any drug. Okay. But there is another one, the same sputum can be done what we call the gene expert. Yes. Gene expert will now be able now to detect the resistance, mainly for 2 important drugs, the rivaroxaban and the isoniazid. Yes. So we can that one is a good, is a more specific because it will also test the resistance. Yes. We can also do the sputum, we can do what we call the culture and sensitivity. That when you tell us the strain and probably the resistance of many other probably that are there. Yes. So we can also do what we call the X-ray. Yes, we can do an X-ray. It will be able to tell us whether you have TB. And the other one we normally do for maybe the latent is what we call the TST. TST is a skin test that we normally do. Yes, we test it and we just inject a certain drug and we'll be able to see the reaction. Yes, so that one is called TST. There is another one for the latent TB, the one that we're talking about, that does not have signs, but it can grow to become a TB. It's what we call the IGRA. IGRA is interferon gamma release acid. It is normally tested the latent TB that is inside your body, so that you can also be given drug to clear that. So these are the common types of drug tests that we normally do. Yes, we have also asked about the treatment. Yes. Treatment there are many.
So yes. I know there's someone who is asking.
Yes.
Can TB be treated?
Yes, it's treatable. Yes. Because number one, we say it's a bacterial condition or infection. So whenever we say about bacteria, it means that it can be treated. The problem is when we talk about virus, because virus mutate and changes. Sometimes it is very hard to treat it. But for bacteria, it will be treated. But it is also important to say when we are talking about treatment, TB cannot be treated by just any other antibiotic. Yes. And that's why we are saying if we miss the case, in the missed cases, and we give a patient a strong antibiotic, it cannot clear TB. And TB cannot be treated by one drug, which we call the monotherapy. You cannot do that. It has to be accompanied of different drugs, allowed 4 types of drugs, so that they may be able to defend each other from becoming resistant. So in the treatment, we have allowed 2 types of treatment. Number one is what we call the disease, the active disease. When we do the test, the sputum, and it is positive, we give a treatment. Yes, and it is normally, the treatment for that is normally 6 months. We are now progressing to 4 months, but not every person who is supposed to take for 4 months, there are conditions. And I believe probably next time, when you have time, we'll be able to explain who is supposed to take for 6 months, who is supposed to take a criteria for 4 months. Yes, but normally we give the drug for 6 months. The first 2 months is called intensive. The 4 months is called continuation phase. And we do the test to make sure that it is over. So for the other treatment is for what we call the latent now. A latent is now treated for 3 months. But that one you take the drug weekly once. But for this one, the other treatment, you are taking daily. But for the latent, you take weekly for 3 months, and you are done. And it will be able to clear even that latent TB that is hiding somewhere that can cause disease. And that one is the one that we normally recommend for doctors and other medics to take in advance, because they are interacting with those people who are sick, so that they don't get infected. The last one for treatment is what we call the MDR. And there are 2 kinds of resistance. What we call the MDR means multi-drug resistance TB. It is mean when it is say multi, it means it is not one drug, it is many drugs. So you can find that it has drugs like 3 or 4 are not working. That's what we call drug resistance. Treatment normally go around 9 months to 1 year. But there is still another resistance called rifampicin resistance, meaning it is only resistant to that particular drug called rifampicin. So the treatment is there, allowed 9 to 1 year, depending with the other thing that probably we may be able to share. Okay. So that is the treatment that we normally give.
Yes.
Yes.
Okay. Maybe I may ask, do you have some side effect of the TB medications? What are some of the major side effects of those drugs?
Yes. I can talk about them generally, without specifying for a drug, because of the limited time we have. We normally tell the people, whenever you give the drugs as a health worker, it's very important to tell the client what they expect, because the client sometimes don't have problem taking the drug. They have problem because when you give them the drug, they develop other conditions, they develop other side effects that you never explained, so they shun from the drug. Not that they didn't want to take the drug, but because of the issues and the side effect that allows that you never explain, they are refusing to take the drug. But when you explain to them those side effects, they will be able to take, knowing that you wanted them and you told them about them. So like we have what we call the yellowish, the brownish urine. Yes, when you take those drugs, because they are secreted by the kidneys and eliminated through the feces and through the urine, sometimes you find urine that is brownish, like the true tea. So you explain to the patient like that. It's not a bad thing, but when you see that, just continue taking enough water, it is going to clear. You can also find it in the feces, in the stool. You find it is allowed, it's a bit dark, like coffee. So you explain to that. There is others like now general malaise, what we call the body weaknesses. That one you can explain to them. But there are others that are very dangerous that we cannot be able to tell the patient to continue. The one that I have already talked about, the patient can continue and finish the drug. But if you see yellowish in your eyes, which we call the jaundice, or in any other part of the body, that one you are not supposed to continue. You're supposed to go back to the facility, explain that you are getting yellow in your eyes or the palm or the mouth, anywhere, and the doctor will be able to change the drug, because that is a severe side effect that can lead a problem to the liver. That's what we call the jaundice. If you find probably severe headache that is not going even if you take analgesic, it is important for you to go back. Don't continue taking those drugs. If you find yourself probably fainting or falling or even having convulsion, if you find yourself probably having what we call vomiting blood-stained vomiters, it's so good to explain to go back to the facility. So those might be the major that you are not supposed to wait. You can go back. But for urine and probably general malaise, mild headache, that one you can bear. Abdominal pain, mild, that one you can bear. Okay. So those are the major. But they are not major. They are not all that severe. You find probably in 10, at least one might have probably those minor. Yes, but the others are okay.
So apart from those medication, or you can change the medication, do you have some antidote of such medication? Do you have some such antidotes of those medications?
Yes, they are there. Okay. Yes, they are drugs that we give to counteract the effect. Yes, so that the side effect does not continue so much. Yes, so they are.
Is it important for patient to complete the full dose of that medication, either for 3 months or 4 months, as you have told us in the determined?
Yes.
So is it so good for someone to complete that full dose of medication?
It is important, because if you don't, and the risk that we have that is that if you don't finish, if you don't take the drug, those people who are watching me, if you don't take the drug and complete the dose, probably some few things might happen. Number one, if you don't take, we can only guarantee that you are healed and you are safe if you complete the dose that you are given. That's the only time that you know. And for TB is good because every step it has stages. After 2 months, we will test the sputum. We will see whether the bacteria have subsided. So if we still find them positive, the sputum was positive at 0 months, 2 months is still positive, it is to mean something that is happening. Either you are not taking the drug like in the right way, the right time, the right dose, or you are missing the drugs, or the drugs is resisting. So if we do the test for resistance and we say it is okay, there is no resistance, it is to mean that you are having problem, you are not taking. So if you continue not taking the drug as you are supposed to do, number one or two major things will happen is that the disease will not clear. So you continue having the problem recurring again, what we call the relapse. The disease subsides, then it comes back again. Or you can have what we call the resistance, the one that we are talking about, either multi-drug MDR, multi-drug resistance, the drug resist, many of them resist, or you have what we call rifampicin resistance. So those are the dangers of not finishing the drugs the way you have been instructed and finishing well. You might be having this problem.
Okay,
yes.
Like someone who is asking, we have a specific vaccine which should be given to someone to prevent him or her from such condition, that is TB.
Yes. Fortunately or unfortunately, Isaac, we only have one vaccine for TB.
Yes.
No other vaccine.
Yes.
It is the only one that we have called BCG. And BCG is also an acronym of 3 letters, meaning Bacilli guerin calmetes. Yes. Bacilli calmette guerin. So BCG is named after the person who detected that bacteria called bacilli, that BCG, that vaccine. So that's the only vaccine that we normally have, and that vaccine is only given at birth. And we normally request people to do it very early. At birth, probably the first 1 week should be given there. And the risk is because if you don't do that, and the child stay for a few months, a few years without having received the drug, the child already become exposed to the TB virus. So when you give that bacteria vaccine, because it is an attenuated bacteria that is wicked, the child might now develop the disease. So that's why we normally give it very early before the child become exposed and the body start producing antibodies against TB. So we want first to give that vaccine. So that is the only vaccine that is given. Sometimes it's not fully effective because you find there are still people who are getting TB in adolescents and they already received the jab when they were young. But it reduces the risk and the killing of by that disease. So it is still helping because this is the only vaccine that we have. Okay. It has its own challenges, own effectiveness, but it is still helping us because it's the only vaccine that we have to give.
Okay.
Yes.
So let me just ask this question.
Yes.
Like we have some diseases or some conditions whereby someone can inherit.
Yes.
So, but first you told us
yes.
a TB can be transmitted from one person to another, either through sneezing or COVID.
Yes.
So, can TB be inherited from
other people?
Yes.
No, TB is not inheritable. It's not genetic. Okay. It is not like the way we talk about diabetes or cancer. TB cannot be transmitted from one person to another. You cannot even transmit it. And it's also good to say that TB cannot be transmitted through eating together. Because some people, when they come together and they eat together and they find that you have TB, they start bringing what we call stigma. They want to chase you away or to run away from you because they think when you are eating or when you are sharing cups that you'll be able to affect to infect other people. TB cannot be infected by sharing the spoon or the plate or the cups. It cannot even be transmitted through shaking hands. No, it cannot. Okay. So it is not inheritable. Disease is a bacterial infection only being transmitted through the 3 areas that we say. COVID, sneezing, or talking, the way we are talking. Okay. Yes.
Okay, do you offer some programs on which you educate people more on, this one is just a brush, we are just brushing, asking the important questions.
Yes.
So do you have some programs which you offer to people to advise them on the same issue?
Yes.
Or what are some of the programs not youth, but the Ministry of Health do to minimize the cases of TB?
Okay.
Yes.
I think one is that we are doing the campaign. We are literally doing the campaign to fight and to kick TB out of the country, of the nation. And I think that is one of the what we call the global goals of the world global goals is to kick TB out of the country completely. So there are programs that are there that are able to help, maybe probably like health information. When you go, those who are listening to me, when you go to hospital, you find posters that are there that are talking about TB, how TB is transmitted, how you can protect yourself from TB. So the programs are there. So what I think we need to step up with about is about the health education, telling people, talking about it, and telling people. Number 3, encouraging people to come for tests without discriminating them. Because sometimes when somebody come and you discriminate, they will not come. In fact, long time ago there before, we used to say any person you see with TB, 40% of those people who are TB, they are HIV. That's what we used to say. But of late, it has been seen, and it has also been researched and found that you can have even allowed even 100 women are HIV positive without TB. So it is not a must that when you have TB, you have HIV, because that was also a mistake that we did when there before, that also stigmatized these people. That when you have TB, even without checking, I am sensing as a medic that you might have HIV. It is not so. You can even find 100 or 40 or even 50 people, only probably 2 who are HIV. The others have only TB without HIV. So it is not a must that it is together.
Okay.
Yes.
According to what you have explained more about TB.
Yes.
So I can see there are some symptoms which corresponds to COVID-19.
Yes.
So what is the difference between tuberculosis signs and COVID-19 signs?
Yes.
I can see they are corresponding. So what's the difference of the two?
I think the major difference is that it is the mode of transmission. Yes. The major. Because for COVID, we used to say you can even get it through touching. Yes. That's why we used to use graft. The one that you can even transmit it through the fluid, like saliva, urine, all those things. That's why we used to disinfect even the toilet and the latrine and everything that we are using, the 4 meters, all those. But for TB, we have said it's different. It can only be air droplet through coughing, talking, and sneezing. But for COVID, it can be transmitted through any other mode of even touch. Yes, so that's the major difference.
Okay. How can someone reach you? Do you also have your online platforms where someone can reach you?
Yes.
So you can just give them your number.
Yes.
And where they can find you through online platforms.
Yes. Yes.
Because of time.
That's okay. So thank you, Isaac. I think you can reach us through our online services. That is Facebook. That is Twitter. That is what do you call it?
Facebook.
The other one that you think
TikTok.
TikTok. Yes. Yes. I'm not a conversant person with that because I'm a bit old kidogo. Yes. But it is TikTok. So the TikTok. But you can also find it through YouTube. Yes, at Siloam Spring. Yes, Center. Yes, you'll be able to find us there. And you can be able to follow. And as Isaac said, normally on Wednesday, every Wednesday, we are talking about one condition that is also disturbing us, or that is a condition that is also bringing burden to the nation, or even to your family. And you can be able to comment there. You can also write to us, asking us to talk about that condition, and you'll be able to share, because it is important for us to help and give back to the community.
So apart from medical issues, what other things can you do?
Yes.
Yes, apart from medical discussions.
Yes. As we said last time, that because we want to be well all out, physically, spiritually, we normally have what we call the Bible study. Yes, on Monday and on Friday. We normally have Bible study where we talk about, we share the word of God from Genesis to Revelation. So you can be able to catch us through the same platform, and you'll be able to be enriched by the word of God. But on Wednesday particularly, it is for health, where we talk about health.
Okay, guys, I take this opportunity to thank you for watching us. So get tuned on the same place, on the same time. If you have any question, you can reach out through our comment section. The support which you can give us, it is just subscribing, and the subscribe is just free. So just visit YouTube, TikTok. We have Siloam Springs Medical Center. You can reach us through that platform. You subscribe, you share, and then you comment. You can drop your question there below on the comment section. So thank you. Bye bye. We shall meet again. Yes.